Hi, welcome, and thank you for joining us today for a presentation on ongoing care for celiac disease and gluten-related disorders. I'm Janelle Smith. I'm a registered dietitian with UCLA Health. This is a collaboration between the Celiac Disease Program and the Digestive Disease Nutrition Program. Now, many people, when they're diagnosed with celiac disease or another gluten-related disorder, may be relieved, disappointed, in shock. There's a whole range of emotions. But the diagnosis is just the beginning. Even once diagnosed, which affects up to 1 in 100 people worldwide, at least 50% of patients, even after they're diagnosed, still report symptoms while on a gluten-free diet. And did you know that 1 in 10 family members will also have celiac disease? Lifelong, there is a 2 to 4 times increased risk of coronary artery disease and small bowel cancer for those with celiac disease. So let's discuss what can we do to protect our health and take care of ourselves lifelong. We talk about that scary statistic first. Here is one study in 2020 that utilized a very large population of Swedish people with celiac disease, about 50,000 patients with celiac disease who were followed over 12 and a half years. The findings were that the mortality risk for those with celiac disease was significantly higher than those for the control population without celiac disease. It was a modest increase, but certainly significant. And the causes of mortality in these cases were most often from cardiovascular disease, cancer, respiratory disease, especially in the first year after celiac diagnosis, as well as in people ages 18 to 39 years old. It's very important that at the time of diagnosis, we get a thorough workup to determine what are our health risks, and that we resolve these within the first year on a gluten-free diet. Many of these items apply to both celiac disease and other gluten-related disorders, but micronutrient deficiencies, low bone density, and poor immune health, including vaccine risk or vaccination needs, tend to be more specific to those with celiac disease. However, monitoring co-occurring autoimmune disorder markers, diet safety of the gluten-free diet, nutritional adequacy, overall symptom resolution, and food-related and disease-related quality of life are essential for all gluten-related disorders. In the first year, we should expect celiac antibodies in the blood to normalize over the first 6 to 12 months on a gluten-free diet. So it may take up to a year or more for the inflammation that is visible in the blood to completely go away. Don't worry, you're still following the gluten-free diet adequately, even if it takes a year or more for these to normalize. But we do want to make sure that they do normalize so that you don't have ongoing inflammation coursing through your body. It's very important to discuss mental health and referrals at the time of diagnosis because this is a critical time of adjustment with many stages of grief that can really determine how well a person copes with adjusting to the gluten-free diet. In terms of medical needs, we want to ensure that vaccines are up to date, including hepatitis B and pneumococcal vaccine, which we'll talk about later. But these are more likely to not be effective in people with celiac disease until they are on a gluten-free diet. We generally want to get a baseline bone density exam because bone density can be lower in individuals with celiac disease so that we know if we can treat it in this first year. In terms of following a gluten-free diet, there's so much to learn in the first year, and it's certainly a process. We need to learn about reading labels for gluten, where it can hide, where we find it. We also need to think about avoiding cross contact with gluten at home and in our food preparation spaces. Next, venturing outside of the home, we need to know how to navigate dining out, how to order gluten-free, how to choose restaurants, and how to know if we're following the gluten-free diet adequately. Holidays and social events are huge. The gluten-free diet changes everything in our lifestyle that involves food. So, adapting to holidays and social events on a gluten-free diet can take a lot of time and accommodations. Then finally, we want to look at the nutritional quality of the gluten-free diet. Step one is to make sure that there's no gluten being ingested. But after that, we really need to think about what else do we need to include in our diet. After the first year, approximately years 2 to 5, we want to continue to do an annual celiac antibody test to ensure that that inflammation is in remission or continuing to return to normal. Many people will consider a repeat endoscopy with their gastroenterologist to confirm if the gluten-free diet has resolved any changes that we're seeing inside the small intestine. Vaccines should be up to date on a yearly basis, and many people will have a repeat bone density exam if they had any abnormalities at the first one. We want to ensure that all previous symptoms of celiac disease are resolving on the gluten-free diet, or if there are new symptoms, that we address those. Again, mental health is key, and the adjustment period continues year after year. We want to make sure that we are redefining joy with food in our life, including with family, friends, dining out, and travel. We want to address any barriers to following the gluten-free diet and accidentally or intentionally consuming gluten, because we know that that increases all of the health risks that we're talking about today. Overall, we want to improve health and well-being in a holistic manner. So let's talk about some specific body systems and common diseases or problems that can co-occur with gluten-related disorders, as well as how we take care of them. At the time of diagnosis, about 14% of people with celiac disease will have osteoporosis, which greatly increases the risk of fracture in our bones. And even more, 40% will have osteopenia, which is a reduced bone density, but not yet at osteoporosis. Thankfully, within the first year on a gluten-free diet, many people will have complete resolution of their osteopenia or osteoporosis. However, we may also need to supplement with vitamins, such as vitamin D and K, as well as minerals that are important for building bone, such as calcium, phosphorus, and magnesium. In order to take care of our bone density, we need to be doing weight-bearing physical activity, and for females, we need to be having menstrual health as well. When it comes to the blood, it's very common for people with celiac disease and non-celiac gluten sensitivity to experience anemia. The anemia could be due to an iron deficiency, a B12 deficiency, a folate deficiency, or just to inflammation. To resolve anemia and ensure that our blood is very healthy, we want to make sure we have adequate amounts of vitamins B1, B2, folate, B6, and B12. Iron is very essential and so common to be deficient in many people with gluten-related disorders. Overall, we need to be getting in adequate protein and energy through our diet to have healthy blood, to have enough energy, and to resolve anemia. But unfortunately, some people with celiac disease will continue to have iron deficiency anemia despite being on a strict gluten-free diet. We still have more to learn about this, but it's hypothesized that the role of inflammation, even if it's lower in someone on a gluten-free diet, is still preventing absorption of iron. The thought is that ongoing inflammation, even though it's much lower in treated celiac disease, may continue to impact iron and folate and B12 absorption. Next, we'll talk about our immune health. There are various immune challenges to those with gluten-related disorders. For one, we know that gluten-related disorders can be triggered by viruses. Many people with gluten-related disorders will also have an immunoglobulin deficiency that may impact other parts of their immune system beyond the celiac. 20% of those with celiac disease will have a small spleen, which absolutely impacts their immunity and their ability to fight off other viruses and infections. Thankfully, on a gluten-free diet, the majority of people with celiac disease will have a return to their immune function. Celiac can impact the liver, the lymph nodes, other autoimmune diseases, respiratory viruses, and even sepsis. So it's very important to stay on top of vaccines, including the pneumococcal vaccine every 5 years, the flu vaccine annually, and the hepatitis B vaccine in one 3-dose series. Additionally, we want to pay attention to the nutrients that really improve our immune system. These include vitamins A, C, D, and E, and the mineral zinc. Phytonutrients and antioxidants that are found in plant foods are so important to our immune system. And as always, we need to make sure we have adequate protein and energy coming in through our diet. Don't forget that movement and sleep are also essential to our immune system. Next, we'll discuss digestive health. There are many digestive diseases that can co-occur with celiac disease, meaning they're not caused by celiac disease in particular, but they may exist in addition to a gluten-related disorder. These can cause ongoing digestive symptoms even when a person is on a gluten-free diet, and may be very confusing for people who may worry that they're accidentally consuming gluten. Common co-occurring digestive diseases include SIBO, small intestinal bacterial overgrowth, disorders of gut-brain interaction like irritable bowel syndrome, inflammatory bowel diseases, especially microscopic colitis, pancreatic insufficiency, lactose and fructose intolerance, Ehlers-Danlos syndrome, and esophageal eosinophilic esophagitis. For these reasons, it's very important to follow up with your gastroenterologist on a regular basis, even if you feel like your symptoms have improved. Here are some key nutrients for our digestive health. Vitamin D, L-glutamine, which is an amino acid, zinc, fiber, hydration, movement, pelvic floor health, adequate protein and energy, and restful sleep. All of these factors will impact our digestive health functioning and symptoms beyond the gluten-free diet. Finally, we'll discuss mental health. 62% of people with gluten-related disorders also suffer from an anxiety disorder, and 35% will also experience depression. While the exact prevalence is not fully elucidated, we also know that autism spectrum disorders, ADHD, and eating disorders are more common in those people with gluten-related disorders. So, while the gluten-free diet can improve some physical and mental symptoms, it also provides many challenges to mental health. To take care of our mental health as individuals with gluten-related disorders, we really need to think about community. It can be very isolating to have a chronic illness that permanently affects your ability to eat with other people. Building community of others who understand is essential to support you on your journey. Our material needs and accommodations, such as access to food, ability to buy gluten-free food, um, so important. Connection, intimacy, spirituality, and gratitude can be various ways to cope with adapting to a gluten-free lifestyle. We can also build resilience to stress because it is stressful coping with a chronic illness. Rest, joy, play, mindfulness, nature, sunlight, nutrition, of course, and movement all are going to impact our mental health. I hope today you've learned how much change is constant for those with gluten-related disorders. These are lifelong and impact every facet of life as well as every system of the body. People with gluten-related disorders have specific physical, emotional, and environmental needs. And if you'd like more help taking care of your gluten-related disorder, please visit any of us registered dietitians at the Digestive Disease Nutrition Program. Thank you so much for joining us.